Forus Health is a company focused on the mission of eradicating avoidable blindness. India has the largest blind population in the world, and 80% of this could have been prevented if they were treated on time. The biggest problem is people don't realize they have a problem, and even if they realize, the access to an eye doctor is very limited. India has only 25,000 eye doctors for a 1.4 billion population. We wanted to create technology where people can be connected to an eye doctor remotely so that they can identify whether they have a problem, and in case they have a problem, they can go and get themselves treated. The first focus for us was to make the last mile point of care devices, because the existing devices at that time were expensive. Second, they were predominantly designed for a Western pupil, whereas the Indian pupils are much smaller. You need to redesign for Bharat. So we started designing those products. Today, we are there in 3 large segments. We are there in the adult retinal space, we are there in the neonatal retinal space, and we are there in refraction. In the adult retinal space, we have an entry-level product called Classic Plus, which goes into vision centers or diabetic centers or endocrinologist or primary health physician. We have an advanced product called Trinetra Ultima, which handles both fundus part as well as the dry eye part. The second area which we focused was on neonatal. India has the largest premature births, 3.5 million every year out of the 15 million global. They can go permanently and irreversibly blind in case you don't screen and treat them on time. There was a product which was available for 1.3 crores made by only one company in the US. We created a product which was far more significantly smaller, and then it was 1/5 the price. So more and more doctors start using this device, and more screening started to happen. And in refraction, we came up with a handheld refractometer which can actually do eye power measurement door to door or at clinics or at primary care. We have now come up with a new innovation, first of its kind in the world, where we have a wearable refractor. You wear this device and I can change your power, and all of this I can do remotely. So this opens up a complete new way of how refraction will be done in the future. Today, we used AI for diagnosing ocular problems, which is diabetic retinopathy, glaucoma, macular degeneration, hypertensive retina, cataract, and dry eye. And then we got into optometry, where a last mile spectacle delivery can also happen without the consumer having to go to an optical store. We slowly realized that if we have to improve our impact, we also have to get into public health. So we started building the platform, and we started implementing it in many state governments. We started working with Andhra Pradesh government, and in collaboration with ACT and CCAM, we started working with the government of Karnataka, which is the Asha Kirana program, which is a flagship program. We actually distributed about 75 of our autorefractometers handled to the optometrists from the government on 8 districts, and 4 districts had about 16 of our fundus cameras, and today government of Karnataka is considering this one of its flagship programs across all healthcare programs in the state. The platform has done over 5 million transactions and has all the hygiene factors like HIPAA, GDPR compliance, DPDP compliance, ISO 27001, ISO 27017, 18. And we wish we would now extend this to Punjab, because now with the help of ACT, we were able to implement about 30 autorefractometers in Punjab, and now the government has taken the follow-up route and actually adding about 250 of them on their own. So these kind of initial nudge to the government with the help of these grants have helped us to scale public health programs in a very large way. We have also started a division which has started to do a last mile screening, and very happy to say that we have crossed about 1 million screenings cumulatively. We have got 9 patents granted and about 12 of them in pipeline, and today we are very proud to say that we have touched more than 25 million lives. We wanted to touch at least 250 to 300 million lives over the next 5 years.